It's a real pleasure to introduce today's expert, Dr. Karen Bourne. Dr. Bourne is an assistant professor at the Institute of Health Policy, Management, and Evaluation at the Dalla Lana School of Public Health at the University of Toronto. She also serves as program director of the Masters of Health Science and Health Administration, a program designed for working professionals that integrates business, management, and health policy to prepare graduates for leadership and meaningful change in the healthcare sector. From 2015 to 2022, Karen served as a knowledge translation lead for the Choosing Wisely Canada campaign, which we'll talk about in a minute, where she played a central role in disseminating content to the public, integrating the campaign into medical education, and fostering international collaborations. Welcome, Karen.
Thank you for having me.
My pleasure. So you led the knowledge translation strategy, the KT strategy for Choosing Wisely. Choosing Wisely, for those of you that don't know, it's an international initiative to explore ways to reduce overuse and unnecessary services and improve patient outcomes. So you led that for nearly a decade. What do you think made the campaign so impactful, and what advice would you give to others trying to design some sort of large-scale change initiative?
Yeah, so first, maybe I'll just spend a minute providing a bit of background and overview of the Choosing Wisely campaign. So, Choosing Wisely first launched in the United States in 2012, a clinician-led campaign to develop evidence-based lists of recommendations from national clinician specialty societies that were first disseminated as an evidence-based recommendation to their colleagues to really help clinicians engage in conversations with their patients about common unnecessary tests, treatments, and procedures in their field. In the US, the context for that was related in part to the costs of care, for individual patients. But I would say globally, this campaign has spread. It first started in the US in 2012. In Canada, where I'm based, the campaign launched in 2014, and it's in over 30 countries around the globe. And mainly in high income countries, but also in countries across every continent. There are active campaigns in South America, across the African continent, in India, and in parts of Southeast Asia. And it really resonated as a quality of care issue because we know, as a healthcare quality issue, that overuse, in addition to misuse and underuse, is a healthcare quality problem, and that there are serious harms to patients associated with overuse. So Choosing Wisely really gave that evidence base for clinicians to start engaging in conversations, both within their specialty, but also importantly, to engage in shared decision making with patients about common overuse areas. So, an example that I think is really helpful to think about in terms of knowledge translation and really with that interface between clinicians and patients when it comes to overuse is unnecessary antibiotics in primary care. So, we know that the majority of antibiotics that are prescribed in the primary care setting, often for things like, in Canada, it's cold here. We have a long winter for upper respiratory tract infections. Those are viral. They're not bacterial, but often patients are getting those unnecessary prescriptions. And from the clinician side, it's often easier to just give them that prescription rather than say, you don't need it. Here are the reasons why. Here are the other things that you can do. And so Choosing Wisely gave that language to clinicians, but then what our knowledge translation efforts really focused on having patients be receptive to that. So some of the things that were developed right away were pamphlets, those pieces of paper you see in your doctor's office that you can read, posters in the doctor's office on the walls, sorry, you don't need this medication, and sort of explaining why and talking about the harms of unnecessary antibiotics. But then another thing that was really novel and unique that we did as part of our knowledge translation effort was we worked with clinician leaders from the societies who developed the recommendations. So maybe they presented at a conference about their list of recommendations, but we also worked with them to write op-eds, opinion editorials in their local papers or in their national papers about the recommendations. So for example, in cold and flu season, we would work with our clinician leaders from family medicine or pediatrics, for example, to write a short 500-word op-ed really directed to the general public, but to a patient, parent reader, to say, cold and flu season is coming. Unnecessary antibiotics can cause harm. Here's one thing you can do. So really trying to get that message across in multiple platforms and in multiple ways.
But also your patient pamphlets, they weren't just, a poster, you don't need this. They all had those catchy phrases, right?
Yeah, so when we so in a lot of our patient pamphlets, I should say, were adapted from Consumer Reports in the United States, an original partner with the U.S. Choosing Wisely campaign that was initially led and more led by the American Board of Internal Medicine Foundation, and they partnered with Consumer Reports because they have that expertise in working with the public, working with the American consumer. And the pamphlets were really interesting because they talked about the harms of the unnecessary test treatment and procedure. But then, really importantly, they had this box that said, here's what you can do. And it would tell people not just don't do this, don't take this antibiotic, but stay hydrated, take an over the counter pain medication, rest, drink hot liquids, because the patient doesn't want to just be told, no, you don't need this, you're fine. That's very dismissive of their complaints. Rather, patients need things that they can do to help them feel better. And if the clinician will tell them it's not the antibiotic, it's not your low back imaging, but here's something that you can do, then that is really what helps to facilitate that shared decision making. And I think that was a really critical contribution of Consumer Reports in terms of understanding what the public wanted to hear from their doctor. It wasn't no and have a nice day. It was no, but here's what you can do. Or you don't need this medication, but here's the plan to help you feel better. And if you don't feel better, here's what we're going to do. And so, really offering the public or the patient this concept of, I don't know if for our op-eds, we talked about news you can use. When someone comes away from reading the op-ed, they had a plan or they had an idea of what they could do. But again, offering the patient something that they could actively do to help themselves feel better that was evidence-based.
Okay. So you also took this KT approach because you didn't just deal with clinicians and with the public and patients, but you also disseminated this knowledge within medical education. So can you talk a bit about why you chose to focus so much effort there and a bit about the next generation of clinicians?
Yeah, I'd love to. So, Choosing Wisely Canada was really lucky. In 2015, we received a small seed grant to think about embedding these concepts of reducing overuse in medical education. And that was really based on evidence that showed that clinicians practice the way that they're trained. And the way that they're trained had been, seek out the thing that is unique or make sure that you're covering everything, run every test just to be sure. And really what choosing wisely campaigns are part of a culture shift in medicine, which is you don't need to run every test under the sun. You don't need to test the patient's blood every day if there's no clinical indication. It was really about changing that mindset of medicine from covering every base towards more of a resource stewardship approach and highlighting that resource stewardship wasn't about saving dollars for the healthcare system or for your organization. It was also about reducing harm to the patient and thinking about that angle of unnecessary tests, treatments, and procedures. Not only, are they harmful, wasteful, bad for the planet, but they're also, bad for the patient potentially if they're having an unnecessary blood draw that could be painful for them. So it's just about creating that mindset in medicine. And so from that, we developed a program called STARS, Students and Trainees Advocating for Resource Stewardship, to try to embed these resource stewardship principles within medical education. And so we partnered with students so that it was bottom up rather than top down in medicine. So we worked with two national medical student associations in Canada that developed general recommendations for students to think about. Ask a question: why is this test being ordered, to really help them put stewardship into practice, in part in their classroom learning, but really in clerkship once they were in the clinical environment. And STARS actually has spread to 7 countries that have Choosing Wisely campaigns, including in the United States, in Japan, Netherlands, and Italy. Again, really trying to shift that culture of medicine away from more is better to more is not always better.
So you're really taking a lot of the evidence that we know and implementing it, or I would say disseminating it more than implementing it, right? In many different, you're doing it with the clinicians, you're doing it with the public, you're doing it with the next generation of one type of clinician, right? A doctor. And these are all, we talk about implementation science and we talk about how important it is, but these are a lot of them are really creative, out of the box ideas that you've done. It's not stuff that we've seen, written up in the literature, et cetera. So where did these ideas come from? Where did they originate?
Well, so that's a great question. And I should say, too, a lot of this work has been in partnership with fantastic colleagues. So, Dr. Wendy Levinson is chair of Choosing Wisely Canada, Dr. Brian Wong, medical education lead, who I collaborated with on this work. Dr. Chris Moriades is a US colleague involved in cost of care. And then the last person I want to mention is Dr. Billy Silverstein, who was a medical student at the time. And so, when Brian Wong and I first received our seed funding to do this medical education initiative, we had looked at the literature, looked at groups like IHI, Open School, for example, Institute for Healthcare Improvement, Open School, and really felt that the bottom up approach aligned with the Choosing Wisely approach, which is a clinician led approach, a grassroots approach to reducing overuse, not a top down approach. But we weren't quite sure how to work with students. So Billy Silverstein, who was a medical student at the time and who is now actually helps to co-lead medical education for Choosing Wisely, and two other medical students, Elliot Lassen and Anand Lakhani, we all worked together. We said, how can we reach students? What are the best ways to do this? And they felt that working with the medical students associations and developing those lists of recommendations would be the best way to do it. And then also the other concept that we worked on was really to seed resource stewardship champions locally. So we put out a call and had two medical students from each of Canada's 17 medical schools become essentially STARS ambassadors. And again, we use that concept of bottom up change, and we said to them, do what you think makes the most sense locally. We provided them with some resources, and some of them launched interest groups. Some of them would have a speaker. Some of them did awareness weeks. But really, we tried not to be top down, but really be bottom up to fit with whatever culture made sense for them locally in order to influence change.
Amazing. So you've mentioned, I mean, we've only been talking for about 12 minutes, but you mentioned so many different partnerships, whether it was Choosing Wisely within 30 different countries, or your STARS program in 7 different countries, local partnerships, international partnerships. And we know that in knowledge transfer and exchange, there's many different aspects that can influence it, but the one that's probably the most important are these relationships. And I feel like you're a guru in almost making these partnerships work, etc. So what tricks of the trade can you share with our audience?
Well, that's a very kind compliment. And again, I think I've really had the privilege of working with amazing colleagues. And I think a lot of us share the same vision, and Choosing Wisely in particular has really been a vehicle for leadership in a very unique way. I think, part of Wendy Levinson's vision for the campaign was that you could seed leaders at multiple levels in the health system, and folks could demonstrate their leadership leveraging the concept of choosing wisely, which is a very big concept, reducing overuse in your field. And so it seeded leaders across clinician specialties, across medical specialties. We haven't talked, I mean, you mentioned briefly about other professionals. Choosing Wisely exists in nursing, in dentistry, and other allied health professional groups. So you can be a leader in Choosing Wisely in cardiology or in dentistry, family medicine, obstetrics, and gynecology. Nationally, you could also lead a Choosing Wisely campaign implementation effort at your organization. So serve more, not at the sort of macro level, but serve more at the organizational level as a leader. You could be a student leader leading curriculum change. So I think this idea of a campaign really was so brilliant in terms of having a big tent with this big concept and a culture shift, but then it being tangible at the various levels where folks have influence. So perhaps if you're involved in a national society, you have influence in terms of developing a list of recommendations, or maybe if have influence on your campus as a student, or you have influence on your unit as a clinician. So I think really giving folks multiple options and ways in which to exercise their leadership is part of the secret sauce that has made Choosing Wisely so effective.
Amazing. So it's really empowering others. Doesn't matter what level you are, etc. And that's a whole other hat I wear in terms of leadership. And that's the program. One of the programs that you're running, right, is all about leaders and training leaders at all levels. Karen, thank you so much for your time. I really appreciate it. I'm sure we'll be talking again. And
Thank you for
yeah,
having me. Thank
thanks.
you. This was great.